this is Bob Rauner with Community Coronavirus Update number 54. We'll talk about some more balanced approach to policies, the three surges before the vaccine that have me most worried, some common myths, and looking for the helpers. So, if we look at countries across the world, we see that there's a mixed bag, and so some people like to bag on the United States versus Europe. Well, both as a whole haven't done the best job, and it's better to think of European Union as a collection of countries, just like the United States is a collection of states. We've all had sort of mixed results, although lately, at least most countries have gotten their act together, whereas we still are muddling through. But within the European, you have country. This one up here is France. They were actually worse than even the United States right now, but the Germans, for example, on the other hand, have done much better, and so it's a mixed bag. The way to look at who's doing the best at the end of the day is how many dead people you got. And so what I do with my day job where I work on quality improvement, sometimes I tell people the ultimate quality measure is dead, not dead, because there's not a lot of debate there. And everything we do in healthcare is to prevent dead for the most part. So at the end of the day, who has the most dead people? They're the ones who got it wrong. And who has the least dead people? They're the ones who've gotten it right. So if you look at the United States, we're not the best, unfortunately, but there's others who have done worse, like the United Kingdom, Spain, or Belgium, for example. But there's several others who have done a lot better than us. Japan, Norway, Germany, Ireland. We should be looking to them to say, well, who's really got it right and who's doing it right, and we should be looking at their tactics. So we should be looking at these numbers and saying, these people got it right and these got it wrong. Let's do what these people are doing. And so, but that's not really been happening much. I think a lot of our policies based on ideology and wishful thinking, not by looking at the numbers and the data. So one thing the Europeans did get right, though, is they almost all kept their schools open, whereas a lot of America still doesn't have its schools open. It's a bad prioritization. There's this economic cost benefit analysis done recently that in Ohio, that the cost of keeping schools closed in Ohio for another semester would have been enormous, 24 to $39 billion, because of the educational declines and losses will accumulate over a child's lifetime. All that to save only 100 to 200 lives. What would have been the economic cost benefit of closing bars and restaurants? Would have been a completely different story. And so we didn't prioritize well. We prioritized bars and restaurants over schools. Many of these current economic cost benefits have been done. Most of what we've been doing for coronavirus actually has been effective, and you can read this article too on the bending the curve in the first wave, and that it actually probably did save money overall. Actually, this podcast from Dr. Emily Oster, an economist, talking about the schools aspect. Essentially, those of us who decided to go ahead and open our schools, I think, did definitely make the right decision, and she goes by some of the rationale why. Now, it doesn't mean you open the schools without taking any mitigation measures, which of course we did, and so far it looks like it's been pretty effective here in Lincoln, for example. And so it's a good podcast to kind of listen to a more nuanced view of that you may not see in the newspaper, unfortunately. And CDC Director Redfield last week talking about how bad this is really getting, unfortunately, and I still don't see a lot of seriousness that it needs in the public policy sphere at the state or the national level. He's really concerned, and I think he's correct, that we'll probably be going to be in the round of 400,000 to 500,000 dead Americans by February if we don't get our act together. And what he is disappointed is that we just didn't take a very strategic look at all this. We didn't prioritize schools over bars and restaurants. I think New York City made a mistake when it closed its schools here last month, whereas thankfully we did not. What I'm most worried about now is the three surges before the vaccine. So we have a vaccine on the way. We should be hunkering down and doing a better job because we know help is on the way. And instead, we unfortunately are letting our guard down. The first is Thanksgiving, then youth sports, and then Christmas. So Thanksgiving, we're still kind of waiting to see what the numbers really show for sure. You'll see these big drops in the data. That's missing data, not that the numbers dropped that much. So a lot of tests didn't run over Thanksgiving, so we're seeing some flopping around of the numbers here. So I think you're probably seeing mixed results, because I do think, well, one, we do know that more cities put in mask ordinances, for example. I think there are more people putting more effective measures in place, so that's helped. That will offset some of the Thanksgiving. And we also have some bad data in that Test Nebraska is telling some people not to get tested now. So it does make some sense from a resource allocation. If you're in a family where someone has coronavirus and now you can't smell or taste, well, you probably have it too. Is it worth testing? Well, maybe not. Maybe it's not. We might as well save that test for somebody else. The problem, though, is that test doesn't show up in the numbers, so it could be throwing our numbers off a little bit. The second surge I'm worried about is youth sports, and canceling all youth sports and activities is a bad idea. We need a balanced approach because there are some benefits of youth sports. Things like, well, kids are more physically fit. It's good for their social emotional development, good for their mental health, and it's a lot of fun as long as the parents don't ruin it. On the other hand, youth sports like a normal year is an even worse idea. So we need to have a balanced approach, and I've yet to see anything come out publicly at the state level about this. Basketball, I really don't understand how you're going to have competitive basketball and keep that safe. I would basically tell a parent out there, if your kid's going to play basketball competitively, they're going to get coronavirus at some point and bring it home to you, because I don't see a way to make that not happen. Uh, Same, unless you're going to do something like that. Same with wrestling, that with rates of spread like this, if your kid's wrestling, they're going to get exposed and they're going to get it. And so it doesn't mean we need to stop it altogether. We can actually still work on skills and cohorting and keeping, they could shoot hoops, they can wrestle, they can have a cohort of four, for example. I've not seen any real measures to try to keep this safe. On the other hand, tennis and swimming, I can see that, tennis, there's plenty of distance, and swimming, quite a bit of distance as well. I think you could make those safe with some minimal changes, for example. So I'm a little disappointed that we really don't have any good oversight by NSA or the state of Nebraska. NSA has basically said, just kicked it back down to the school districts, which is wrong. The reason NSA, I think, was formed was so the school districts wouldn't have to make all their own hodgepodge of rules when they're competing with each other. And the NSA, hey, in their own mission statement, part of what they're supposed to be doing is keeping the kids safe. And so the lack of guidance from NSA is very disappointing. Also, the state should have a role here as well. It should be under the directive health measures, and Governor Ricketts has told health departments they can't make their own rules. He's going to make them for him, so it's really on the state of Nebraska to come up with these measures, which I still have not seen. Myths that I keep hearing. So one myth I keep hearing is, oh, well, the deaths aren't really there. I saw this article from an economist who said that, when she runs the numbers, there are not many more deaths than the rest of the country. Well, actually, no, it's not even close. And so how do we figure this out? Well, one, we have mortality statistics going back decades or a century. We know basically about how many people die per year, and there's actually a website which I've linked to on the notes section, where you can look at the website and look at the drop downs yourself. Every year we know, based on decades of experience, how many people typically die in a week. We know that there's an upturn typically in the winter because of influenza and pneumonia and other things that will happen in the winter. We expect that. Occasionally have a bad year, and so the orange line is when things are significantly worse than expected. And a couple of years ago we had a bad flu year. This is what a bad flu year looks like. Well, what about coronavirus? Well, when we crossed into coronavirus territory, this is what happened. So you'll see that these are all how many deaths we've been having since coronavirus hit. So not even close to a typical flu year. What happened with that economist is, if you look here, there's a drop at the end. The drop in the end doesn't mean numbers are going down. The reason that drop is because not all the death certificates are in yet. And so the person extrapolated from the wrong date range, came to the conclusion that deaths weren't up because they didn't understand how death certificates work and the timeline for when they come in. And actually, if you hover over this on the website, a little disclaimer pops up and says only 60% of death records are submitted but within 10 days, and it varies by jurisdiction. So that date range was wrong, and that's why that number, that common mean, was off. We know how bad it looks like from New York City, for example. Recently had the anniversary for Pearl Harbor. Pearl Harbor, by comparison, would have been this little blip right here, also about the same number of deaths for one world child during 9/11, just this one little blip. So obviously this is way more deaths, and this this didn't come from a couple suicides or because someone in a motorcycle crashed and got coronavirus. This is 30,000 deaths, and so that's how big this is. Same thing now is happening across the country. You have North Dakota, numbers headed up. This dip here is not real. This is because all the death certificates aren't in yet. So the real number is going to be way up here. Hopefully it doesn't look as bad as New York City, and Nebraska is not too far behind. So who is right at the end of the day? Like I've said before, at the end of the day, who has the most dead people and who has the least dead people? The people with the least dead people got their measures right. Well, if you look at here in Lincoln, Lancaster County, we're in Congressional District 1. I like this site because in globalepidemics.org, you can look at it by congressional district. And congressional districts are roughly the same population size, so it gives you some comparability within a region. Well, we've had a lot fewer deaths than all the congressional districts surrounding us. The Iowans are in the 400, 500 range too, by the way. And so something is going right here in Congressional District 1. Well, it's because Lincoln Lancaster Health Department, because of a quirk of state law, can put its own health measures in that are more restrictive, and they've worked. And not only they've worked, though, they've actually done it by not hurting our economy, are as bad as others might expect. Our unemployment rate's still about 3%. And so in Lincoln, which is about half of this congressional district, is 103 deaths versus the rest of the congressional district at 193. So our economy is still pretty good, other than obviously some bars and restaurants, and tourism had a hit. But we've done that, and we've actually saved the lives of somewhere between 150 and 400 Lincolnites because of what we've put in place versus other congressional districts. And so I think our mayor and our city council and our health department deserve some credit for sticking their neck out there, doing the right thing, and catching a lot of flack, and even have a threatened recall. Well, all what they did, though, did save the lives of 150 to 400 fellow citizens, and they deserve some credit for that. So at the end of the day, again, just like before, who has the most or less dead people? Well, Lancaster County versus the rest of the state, it's not even close. Myth 2, doctors and hospitals falsifying records to make money. Yes, hospitals get paid more for a coronavirus, but that's because they use more resources. When the coronavirus takes a lot of time, personal protective equipment, so of course it costs a little more. But hospitals don't diagnose, so they can't falsify that diagnosis. That comes from a physician order. Physicians diagnose, not hospitals, and the physician is not going to risk their medical license to make money for the hospital. And at the clinic level, it's actually been a problem as well. A lot of clinics have actually lost income this year because of decreased revenue during the shutdown and because of the increased costs in personal protective equipment. This summary from Health Affairs thinks the average primary care doctor lost about $67,000 last year. So we're not doing this for the money on the healthcare side. Last myth is you can leave your mask off the table. That's wrong. We do know that coronavirus does spread through a restaurant. Several famous cases of a restaurant, a coffee shop. In this coffee shop, 27 other people got infected. And so there's a mistake, and I think some of the people out there saying, well, I have no idea how coronavirus, I think they're following the rules when they're really not following the right rules. So a restaurant might say masks are not required when seated at a table, but you should wear one. Essentially, the only time, if you're going to go eat at a restaurant, which I don't, by the way, on the inside, I only eat at the outside, you should only take the mask when you're taking a drink, because when you take a drink, you hold your breath, and when you're actively eating. Other than that, the mask should be right back on there. You should not be talking without a mask on at a restaurant. And that's where I think some of the spread, where people say, I don't know, came from, is probably from things like that. Another source of misconfusion, unfortunately, the CDC rolled out some new recommendations which are causing a lot of confusion to people. It helps to understand the rationale. 14 days of quarantine is still the best, by the way, and the reason is because of the incubation time can last anywhere from 2 to 14 days. Now, the average is 5 to 6 days, but people will sometimes develop coronavirus on day 12 or day 14, so it depends how careful you want to be. If you want to be 99% careful, you should do 14 days. If you want to be 90 to 95% careful, 10 days, and the minimalist, I don't know, maybe this is like 75%. So the thinking behind this was, don't let perfect be the enemy of the good. We have so many people not following 14-day. Maybe we'll make a 10-day recommendation in the hopes that more people will follow. So essentially, 80% quarantining for 10 days is better than 50% quarantining for 14 days on a population level. On an individual level, however, it's completely different. If it's me and I don't want to expose my parents or my father-in-law, I'm going 14 days. So just because the state says you can do something doesn't mean you should do something. State and a lot of these recommendations sometimes are the minimal things you should do, but me, I care about those around me. I don't want to accidentally infect somebody, so if I have a significant exposure, I'm going to quarantine myself for 14 days because I don't want to expose my father-in-law or my coworker or my friend who has a kid with heart problems. I want to keep them from getting it. I'm not worried about me getting it so much as I'm worried about everybody else getting it. And so you need to think of this differently. There's what you can do and what you should do. And the vaccine is really close and it's on the way. If you want a good explanation, Z-Dog had a really great recent podcast, which I've got a link to in the notes section as well. He's an interesting guy. He's an internist, very bright internist, but he actually saw him speak at a national conference one time. His goal in life actually was not to be a physician. He wanted to be an entertainer like Weird Al Yankovic. So he took his medical, and he actually, if you see him in live, he actually has a really good sense of humor. But this is actually just a really good explanation of what mRNA vaccines are, how they work. And I am at the point where as soon as it's out, I'll be getting it. I think the data is good enough that it's safe enough that I would get it personally as soon as my name is called up. And lastly, I want to finish with some positive stuff. If you look at some of the history of what Fred Rogers does, I remember seeing him when growing up, and he was so far ahead of his time. But one of my favorite videos of him is telling how do you counsel kids when things are going wrong around tragedy. And something his mom told him, that if you look for the helpers, you know that there is hope. And so look for the helpers. These are very trying times, but there are a lot of helpers out there. Really happy that Times Person of the Year was the medical workers, the people putting their lives in the line for people like you. Look for the helpers, support those people. If you can't be one of the helpers, at least help the helpers. And again, Again, like I said a little while ago, a local group put together this L&K Heroes group. Frankly, they give gifts to frontline workers, doctors, nurses, teachers, and so it seems to be taking off. And it was put in the paper here last week. So if you want to help out, if you're not a helper yourself, and you want to help the helpers and recognize them, go to L&K Heroes and make a donation and or send a thank you to someone you know that deserves this. So hopefully this is all helpful to you. I'll try to keep doing these. Again, disclaimer, of course, these are my opinion, not necessarily the opinion of the people who I work with or for, but this is what I do for a living, so you know my background.